Well, pregnant women typically have to avoid a lot of ingredients, and we're not just talking about food or what they drink. Some skincare products may not be safe to use during pregnancy or even right after giving birth, but it doesn't mean women have to sacrifice their skincare game. So let's talk more about it. Dr. Kim Nichols is a board-certified dermatologist and mother of 3 herself, and she's here to share some easy ways to treat those common skin dilemmas that we all have while also keeping you and your baby safe. Welcome back to the show. Nice to have you with us.
Thank you. Thank you. I'm so glad to be here.
So let's talk about it, because women's bodies, we know, go through a lot of changes, especially when they're pregnant. What are some of the potential skin issues that could happen?
Well, let's talk about the good news first, which is that pregnancy glow that we talk about. And pregnancy hormones can actually bring oxygen and nutrients to your skin, which actually give you that glow. The bad news is that pregnancy hormones like progesterone can actually increase oil production, leading to a lot of acne and breakouts. So a lot of pregnant women can suffer from that during those 9-10 months.
Okay, so if we're looking at ingredients that we can, all stay away from, or pregnant women can stay away from especially, what are some of the most common ones that makes it potentially unsafe for them?
Well, we always want to side on safety. So retinoids, I would say, would be the #1 thing to avoid. And retinoids are derivatives of vitamin A that are used to, help with wrinkles and certain creams. So stay away from those in pregnancy, because they can actually lead to birth defects in the end if used too much. And the second one would be something called hydroquinone, which is actually a skin lightening product that can be found. And a lot of pregnant women may want to use it because they can get some brown spots during pregnancy. But it's not been proven to be safe during pregnancy, so I would avoid that during those times.
All right, so if there's one thing that should be used every day, what do you recommend, especially for pregnant women?
Sunscreen, sunscreen, sunscreen.
Yeah.
Because again, those hormones can cause something called melasma, where you get these dark spots. So use that sunscreen every day. But I would stick with, what we call physical sunscreens, not the chemical ones, while you're pregnant, just for, to be on the safe side.
All right, you have something you call mandelic acid. What is that and what does it do? You recommend that, correct?
Yeah, so mandelic acid is actually a great alternative to retinol. It's an AHA, or alpha hydroxy acid. It's found in a lot of products that are even over the counter. And it helps to exfoliate the skin to keep it looking fresh and glowy during pregnancy.
So I'm curious about this. I know there are a lot of spas that have popped up recently, and even some dermatologists offering treatments for moms-to-be or for new mothers out there. Do you think those are safe to do, and is there any particular one you recommend?
Yeah, I always tell pregnant women they don't have to, let their skin go during pregnancy.
Yeah.
There's certain procedures like facials, which can bring hydration to the skin, and even certain chemical peels, which can help to exfoliate the skin, have been found to be safe during pregnancy.
All right, that sounds good. Dr. Nichols, it's always good to have you. Thanks for joining us again this afternoon.
Thank you, and enjoy the coming days.
Yeah, you too. Well, for more skincare tips, you can follow the doctor on Instagram at NicholsMD_dermatology to check them out.